What's up, ladies and gentlemen, boys and girls around the world? I would like to welcome you back to the Real Talk with Zuby podcast. On today's episode, we've got on my man, Mike Hart, who is a family doctor from Canada. So welcome to the show, Mike. How you doing?
I'm good, brother. Thank you so much for having me on.
No
I've
doubt,
been
man.
looking forward to this for a while, ever since we connected.
I'm happy to hear, man. I've done a super brief intro there, but tell people a little bit about who you are and what you do.
Sure. So, like Zuby said, I'm a family doctor. I'm from Canada. I've been practicing for about 7 years. I do a lot of lifestyle medicine. So, I do a lot of coaching with the patients with like diet, nutrition, things like that. And mostly, well known for cannabis. Mostly just using it as a medicine, and certainly not as something that would ever hurt someone. Because obviously, even though cannabis is a good medicine, there are risks and benefits to all medicine. So that's where most of my focus is these days. And just a little bit about myself and why I've connected with a lot of stuff on Zuby. We have a lot of the same, I think, feelings about COVID, and I've certainly been telling people that lockdowns are not good for people, and they're really not good for patients' mental health. And then also too, like Zuby, I'm really into working out and MMA and all that type of stuff. So that's why I wanted to connect today. So happy to chat with your audience about whatever you want to chat about.
Yeah, absolutely, man. So how did you actually get into the medical field? What was your main interest to get into that to begin with?
So I did my Bachelor of Science in nutritional biochemistry. So I was really interested in nutrition, like from a young age. Like I started working out like with weights when I was like 14. I was on like the whole like protein thing at that point too. I was like 15, 16. My friends used to say to me after a few hours, like, "Oh, Hart's teeing out," because I wanted some protein. So yeah, I just really got into nutrition, and then from nutrition, I wanted to do something more than just being a nutritionist. So got into medicine, and it's just been a great journey ever since.
Awesome, man. And it's interesting that you mentioned the whole situation with the response to the pandemic, the lockdowns, etc. It seems like there is a side of the medical world, if you want to use the term medical community, who is not really having their voice heard on this issue. This whole issue over the past year, one of the weirdest things to me about it has been it's been very, very one-sided, right? People are acting as if all doctors and people in the medical world, or even all scientists, have reached some sort of consensus on this, as if they've advised that we need to have these indefinite lockdowns and all of these crazy restrictions and the mask mandates and the double masks and the triple masks, all of this stuff. To this day, a lot of it is there's no consensus on it, right? There are studies that say one thing, there's things that are saying the opposite. And what is going on there in terms of, from a doctor's perspective, what do you think is going on there?
Well, I think they're really just trying to only let the voices that are very pro lockdown be heard, and all these regulatory bodies that govern nurses and doctors. What they're trying to do is really just control them, and they don't want the truth to come out, so to speak. And there's one of my colleagues. She's a great person to follow online, and her name is Kulvinder Kaur. She's been very anti-lockdown on Twitter. And just recently, it's really disappointing to see. But the college, the College of Physicians and Surgeons of Ontario, they cautioned her about some of her tweets and things like that. And I've never met Kulvinder personally, but I just know her through online and through Twitter. And you can just tell that this person is genuinely just trying to help people. And not only is she just genuinely trying to help people, she's also putting out good, high quality evidence, like really good evidence. And I've learned a lot from her since I've been following her. But unfortunately, a lot of these people like her are being censored. And like I said, last week was just, an example of how she was being censored. She had, again, some type of caution from one of our colleges. And so that's the reason why a lot of these doctors and nurses who, want to say something aren't saying something, because, and I can understand them, it's because they're afraid of losing their job. They're afraid of like the college coming after them. But the reality is, like you said, Zuby, like a lot of the studies are very conflicting, and some of them actually, a lot of them, from what I can see, really show that lockdowns don't work. And that's the big thing that I'm against, is the lockdowns.
Mm-hmm.
And like the masks is a different story. Like, masks can work, but like they need to have like a proper setting for that. Like when I was in third year med school, like someone taught me how to wash my hands, and then like you put on a mask one time that was clean,
Mm-hmm.
and then after it you would throw it in the garbage, right? Like if you're having surgery, you don't want the mask, you don't want your surgeon wearing a mask that was in his car for 6 months that he just picks up every time. Like you want a mask that, like, he washed his hands, he got a new mask, he put it on and used it, and like that's not being done. And like I don't know if it's like possible for us to like use masks properly in that way. And like I know there's like a Cochrane review study, and I can send it to you after if you're if your listeners want to see it, that said that like there's not really any effectiveness right now regarding the wearing of masks. So we need to be careful about what we're saying to people. And I think that and I really appreciate you giving me this platform so I can say some of this stuff, because like you said, both sides of the story are not being heard, and we need to be, much more proactive about discussing things like vitamin D. I mean, I know you've preached about it a lot of times as well,
Yeah.
Zuby, but I've been saying it since like day one, and even prior to that, like, and I made a tweet like recently, like even if I'm wrong, even if everyone's wrong about vitamin D, who cares? Because if you have high vitamin D, a high normal vitamin D, you don't want to have to be too high. You're going to have lower rates of other diseases like osteoporosis. Low vitamin D is also linked to low testosterone, which is another thing I know that Zuby, as well. So there's these things that like doctors are preaching, like I've said, like take your vitamin D, exercise, sleep well, avoid ultra processed foods. Like, how are these things controversial at all? And that's where I think the narrative needs to change. We need to have more doctors coming out and telling people that your immune system is something that you have to take care of. It's your personal responsibility. It's not the government's.
Mm-hmm.
And that way, if people took more responsibility, I think we'd have a better response.
Yeah, absolutely. And it's crazy because I think people like myself and yourself, we've been preaching this for decades, right? We've
Yeah.
been telling people from early, prior to any virus like this going around on this sort of scale, we've been saying, maintain a healthy body weight, exercise, train, eat good food, don't eat garbage. I mean, there are a lot of garbage food options out there, as we all know, but there are also a lot of healthy, great food options out there. So it's actually like, if you look at the countries and the areas that have been hit the hardest, what's one massive factor besides age of the population? We know it's obesity.
Yeah.
It's obesity, and we're living in this culture where if you say that, you'll have certain people who are saying that you are being mean or you're fat shaming or you're doing something like this, and then 2 seconds later, this person is screaming their head off at you to wear an effing mask. Whereas with a mask, it's like, firstly, man, there's a lot to go through here. I mean, there's a lot of bizarre things going on. One of them is this assumption that every single person is diseased, right? People have been programmed and propagandized now to treat healthy people, sick people, everybody the same, right? Everyone is just sick, right? They don't say healthy anymore. They say asymptomatic. So even if you're perfectly healthy, you have no symptoms, you're in perfectly great shape, you're still supposed to be doing all this nonsense. And it's very, very odd to me. It's I don't know. I've never seen this sort of mass psychosis in my own lifetime before. And something that's really interesting with it is, a lot of the people who are saying things like follow the science and believe in the science and trust the experts and all these things are not behaving in a rational and scientific way. And one of
Yeah.
the weirdest things about that, as we've touched on, is this whole thing that we're not meant to have conversations like this. You're not meant to ask any questions. You're meant to just accept this doctrine and this dogma as if it were some very hardline religion, and nobody's supposed to ask questions. If you ask a question about lockdowns, you're a bad guy. If you ask questions about the efficacy of masks, you're a bad guy. If you question the impacts on people's liberty and other aspects of life, you're a bad guy. If you question the vaccine, especially if you're young and healthy and whether you actually really need this, you're a bad guy. It's like people just want you to shut up and do what they say. And that's happening on a national level, on an international level. It's happening within the medical and scientific communities. It's happening on social media. It just seems to be happening everywhere. So what's going on with that?
Again, like I think that a lot of it, comes back to, they're just not allowing all the voices to be heard, and they're censoring the voices that are, suggesting something that is against what the government is mandating. And we really need to get away from that, and if you look at something like, I'm sure Canada's food guide is very similar to whatever Britain's food guide is, which is basically like Canada's food guide is garbage, right? So we know that like it is. So we know that what the government is trying to tell us is not effective. And coming back to especially for nutrition, but coming back to like even vitamins and vitamin D, which we talked about, which we know is so important. Not only just for as we said, like preventing COVID, but we've had evidence that it can prevent the onset of upper respiratory tract infections for years, for decades. So, coming back to that, like a lot of the government agencies and medical institutions will say that like even if you have osteoporosis, they're only saying to have like 2,000 IUs a day. So, a lot of people are probably wondering, how many, what do I recommend? So there's a society called the Vitamin D Council, and I've followed them, I think, since 2014 or 2013. It's been a while now, and they recommend 1,000 IUs for every 25 pounds of body weight. So
Okay.
like, I'm a 200-pound dude, so I need to be taking like 8,000 IUs a day.
Mm-hmm.
And like I can tell you firsthand, like I see patients in my clinic and I test them for vitamin D all the time, and almost everyone is low. And people will say like, oh, I've been taking my vitamin D. How is it low? It's because you're taking 1,000 IUs a day. Like that's nothing. Like you need to be taking at least 5 times that, in some cases more. So, again, like I think we just need to look at like, what has a government ever really done in terms of health? And they're not looking to optimize your health. Like they're just looking to make you, not at the very bottom level of health. That's it. Like they're not trying to make your health optimal. They're not going to give you any suggestions to make your health optimal. And I think, they're doing that again with COVID. It's a way where like they're just telling us again to stay, inside all the time. And again, coming back to vitamin D, and this extends much beyond vitamin D. And in the sun, you can kind of see this little background I have here now, but like bright light is very important for your overall mood and your well-being. Like I just did a video on it. And, if you don't get enough bright light, if you don't get enough sunshine, your serotonin is not going to be optimized. So you're not going to feel very good. And I know you're the Jordan Peterson of rap, so you probably know quite a bit about serotonin. That was a great song, by the way.
Thank you so much, man.
Yeah, man. So that if you don't have the proper amount of vitamin D, you're gonna show up low, and you're gonna be more susceptible to these infections, and one of them being COVID. But like I said, you're also gonna be more susceptible to just the common respiratory tract infections, the common cold, and also to depression, to low testosterone. So we need to make sure that we're not following like the guidelines that are put out by the government, and follow maybe different guidelines that seem to have your optimal health in the best interest. So I think that's the big difference between the government and what, say, you and I are trying to do for my patients and your listeners, is to get people to feel their best, to feel optimized. And that's not the information that you're going to get from the government. You're going to get information that makes you basically just barely not sick, or maybe even sick. So that'll be my answer to that.
Are there any governments that you think have handled that aspect of things well? I actually did ask this question on Twitter, because I think I have followers in literally every single country in the world that you can access Twitter from. And interestingly, I had multiple followers from India say that from early on, the government in India actually was talking about this stuff. They were talking about the importance of exercise and having a healthy body weight and eating certain foods and having your vitamin D, etc. But it seems like in the West, in the UK, in Canada, in the USA, and countries in Europe, etc., everything was just about the wash your hands, social distance, masks. Nothing was really about what you can do to make your body, make your immune system stronger to deal with this thing. Everything was just about just these other type of guidelines that don't really have anything to do with health, that are more about distancing and barriers rather than making your body strong. So I guess the first question is, why do you perhaps think there's that disparity? Why do you think that so many? Do you think it's incompetence? I mean, can it really just be incompetence, or is there something else going on here?
Well, I think there's a couple of things. So first of all, like most of the countries you just named, like North America and like Britain, and I'm kind of putting Britain in with North America now because you guys basically seem to have all the problems that we have, diabetes and all that type of stuff.
Yeah.
These countries, generally speaking, are very very pharmaceutical based, and they don't really look at natural health and natural alternatives. Whereas like countries like India, and traditionally, they use less pharmaceuticals overall, and they're not being thrown, SSRIs or which are selective serotonin reuptake antidepressants, for depression and things like that. They're taught other things. Like they use things like saffron and things like that in some of these other countries. But in North America, everything is just so pharmaceutical based that I think that they don't focus anything on natural medicine. And I think that some of these other countries, do focus a little bit more on natural medicine. And that's why, they're probably chatting about it a little bit more because, if say we were focused on natural ways to, help the human population, well, like we just discussed, we'd have a different food guide and we'd have a different, recommendations for vitamin D pre-COVID. Right, the vitamin D recommendations, should have been discussed and changed pre-COVID because they were way too low then. And then, coming back to the incompetence thing, unfortunately, there's doctors that I follow on Twitter and have respected them in many ways for a long time, and they've come out and since COVID has started, and they've really not said anything positive with regards to how we can strengthen our immune system or how we can bolster our health by using things like vitamin D, and and they certainly seem to shun any type of like physician or speaker or anybody who says any of these ideas. I can guarantee you right now, there's a million, there's lots of people right now that think that I'm a quack just because I'm saying that, we should be taking vitamin D, exercising, sleeping, and avoiding, ultra processed foods and high sugar, because high sugar, I forgot about that in the first time, can also decrease your immune system. So I think that we need to change the narrative in these countries, in North America and Britain, and we need to get doctors more interested in alternative medicine and in medicine, that because a lot of times when you mention alternative medicine or other types of medicines, a lot of these doctors say, "Oh, that's not evidence based. That's not evidence based, and this guy's a quack." Whereas if you actually look at the evidence for vitamin D, it's very, very strong.
Yeah.
So, we really need to, I think a lot of it starts with educating the doctors and changing the curriculum on all this. And again, I've kind of been through this, one time before because, again, I prescribe cannabis, and I was one of the first ones to do it in Canada. And I knew that it was a medicine that was much safer, especially when you're just taking it as an oil. Of course, I don't think you should be smoking, or you should avoid smoking when you can. But, I knew that it was a medicine that was much more effective and a lot safer than a lot of these pharmaceutical drugs. And, that just goes to show you that they're not looking all the time at the best medicines that have the most efficacy with the least amount of side effects. And then if you talk to anyone who's used CBD oil versus say a traditional antidepressant, I don't want to say everybody, but most people will say that they get better results and they get less side effects when they're using pure CBD oil. So that's just another example of how the government has prevented us from accessing something that we should have been able to have access to before.
How much of this do you think is being led by science versus social pressure and groupthink, just in general? Because so much stuff that's going on here is it's not rational and scientific and evidence based. These are the things people like to trot out. But if you're walking outside by yourself in a park wearing a mask, like, what does that have to do with science and logic and rational behavior, right? If you're packed into a tight area with a lot of people, okay, I can understand a rationale for wearing a mask. If you actually are sick and you have symptoms but you need to somehow go out in public or something, especially in an indoor area, I can understand the rationale to, wear a mask perhaps. I still don't think they should be mandated. But yeah, I mean, it seems like people are just operating off of fear and hysteria and groupthink. Like, and this is clear, right? Because the guidance around this time last year, the guidance even from big scientific organizations was do not wear a mask, right? Don't wear a mask. Masks are not effective. There's not much evidence for them. I mean, that's when I think that they were sort of telling the truth. I think explicitly telling people not to wear them, that seemed to be something to do about their own self-interest. But in terms of them saying that people don't need to wear them and that there's not much evidence, I think that was when they were being honest. But then a couple months later, it went to, okay, wear one, to, you must wear one or you're some sort of villain. And now they're talking about double masking and they're talking about triple masking, etc. And you can see that most people are not asking questions. Most people are just kind of going along with the majority, which, I kind of have a saying that the majority does what the majority does. The majority is always going to be the majority. But just because a lot of people are doing something or a lot of people have a certain belief does not mean that it's correct. We've seen this all throughout history, and the people who go against the consensus always are going to get attacked. But I think if you're talking about science and you're talking about medicine, it's so important to be able to hear all the voices and for people to not get silenced, right? I'm not here trying to silence any of these perspectives, whether someone thinks that masks are super effective or they're not effective or they're somewhere in the middle, or someone thinks this treatment or that treatment. I'm like, I want to hear all the different voices, just like I always have in nutrition. I'm willing to listen to the people who say that plant-based is the best way to go. I'm willing to listen to the people who just eat beef and prescribe a whole carnivore diet, and the people in the middle, and the people doing keto, and this, whatever it is, high carb, low carb. I'm just listening to everybody. And yeah. I just think it's a really dangerous precedent when people are being silenced like this, or people are being censored, because, you could have 100 people who are wrong and one person who is right, and that one person is being treated like a psycho and no one wants to listen to them or whatever because they're in the minority. But there have been many situations all throughout history where that person is right. So I think we need to hear all the voices.
Yeah, I think, that comes down to just, your like perspective and your mindset on like a deep level. You have to be an open-minded person. And if you are always involved with, groupthink, you're not really going to have your own opinion, and you're not going to investigate things on your own, because you're just going to be looking to, follow the group, so to speak. And people like being agreeable. And again, your buddy Jordan Peterson talks about that a lot. But people like being agreeable. They don't like confrontation, and they avoid confrontation. And so if all of your friends and everyone your colleagues are saying that we should be doing all these things like social distancing and all this stuff, and again, not that I'm completely against that, then it's going to be very difficult to like question anything, because you're going to be ostracized by your friends, by your colleagues, by your peers. Yeah. So and when you look at the people who are like questioning these things, it's all people who have questioned something before, so like for yourself, for example, like, you have a Bitcoin t-shirt on, and yeah, I'm a Bitcoin guy too.
Of
You
course.
actually did a podcast with one of my like childhood friends, John Vallis. um,
Okay, yeah.
so yeah, so I'm into Bitcoin as well. So a lot of people who are into Bitcoin are independent thinkers. They thought, what, I think that there's something going on here. I think that Bitcoin is actually a legitimate currency. It's decentralized. It's not controlled by the government. Like, let's do this type of thing. And then going back to like diet, again, I've never done the carnivore diet myself, but I do eat a ton of meat in a fairly low carb diet, which again is against like what I was taught in school in conventional wisdom. I mean, I do have a degree in nutrition, and just hilariously enough, I mean, none of my professors were lean at all.
Of
Like,
course not. Of course not.
like, I would say actually on average they were worse. You know what I mean? And then
Yeah.
like me eating, like, I'd always be eating like at least a gram of protein per pound of body weight. And like, to come up in my class at like, oh, you only need like 0.36 grams per kilogram. And everyone's staring at me like, see, Mike, I told you. And it's like, okay, well, look at you and look at me. Okay.
Who's
So
jacked? Who's
I
jacked?
yeah, like, I keep doing what I'm doing. You're going to keep doing what you're doing. So
Yeah.
like, I think that a lot of the people who are joining the narrative and just in the majority, they have this mindset that like, the government wants our best interests in mind. We shouldn't question anything. They tend to be very agreeable people,
Mm.
and that's why they have that type of mindset. Whereas the people who are questioning COVID, questioning lockdowns, they seem to be people who are a lot more independent. And in general, like, I think they've had at least one thing in their life where they've kind of deviated from the majority before, and that's why they may feel more comfortable deviating from the majority now. And that's the way I kind of see it. And a lot of the doctors that I know that are against it, they do have that type of attitude. They're people who are have kind of made their own careers, so to speak, and they think for themselves, and that's how they manage their practice and manage their patients. So, hopefully we can have more and more doctors like that come out, and not just doctors, nurses, healthcare professionals, and people who don't work in healthcare as well. Just come out and chat about this and voice their opinion and let people know that we shouldn't necessarily just be listening to the government and follow all these mandates, and that there's better ways and better organizations and people to follow, like yourself online, so that we can get more perspective and get better results. And I think that again, it just comes down to your mindset on a very, very deep level. Like, are you an open-minded person who's willing to go into confrontation, or are you sort of like a closed-minded person who shies away from confrontation and just likes following the narrative? And it's a lot easier for people just to follow the narrative
Oh,
than
for
it
sure.
is to engage in conflict.
Yeah, absolutely. But it can also be very, very dangerous, as we've seen, now and all throughout history. As I've said, the majority opinion or the narrative is not always correct. So people should always, as far as I'm concerned, people should always be asking questions. I've said before that I'm less interested in telling people what to think than I am in telling them to think,
Yeah,
right?
I like that.
Yeah, I want people to just think. Every day, what I'm doing there on Twitter or even with my podcast, etc. I'm not just saying, look, I'm Zuby, I'm the authority, I know everything, I'm always right. Just listen to exactly what I say and forget, the other 7.5 billion opinions on Earth. I'm just saying, like, yo, question things. Question me. If I say something and it sounds weird to you, question it.
Yeah,
If someone else says something, just because they're wearing a lab coat, it doesn't mean that they're, an all-knowing seer. The truth is that individually, we each know far less. There's far more we don't know than we do know. Even if you're a physician, even if you're an expert in this field or that field, even within your own field, let alone outside of it, right? Like, there's so much stuff that we don't know. But collectively, we've all got different knowledge, different ideas, different opinions. I'm very much of the opinion of throw them all in the ring, and good ideas do not need to fear bad ideas, because if you let things go, then the stuff that works and the stuff that has evidence and the better arguments, etc., should win, right? This is like I said, this is the thing that's been freaking me out about this whole science as a religion slash cult thing that's been going on, where it's just become dogma and you're not meant to question anything. I'm like, to me, that's not science, right? The scientific method is about inquiry. It's about inquiry. It's about trying to falsify things. It's about trying to prove things. It's about asking questions. If something is scientific, it should not fear questions, right? If you can't question it, then it's just dogma. And I don't like the way that people are shaming people or bullying people or calling people names or going to all these extremes to essentially just sort of shut people up who they disagree with, right? So I've taken a pretty hard stand on a lot of this stuff as someone who's very libertarian minded and don't think that the government has the right to lock you up in your house if you're, I was going to say if you're perfectly healthy. The healthy part doesn't even matter. I don't think the government has a right to lock you up in your house, period. I don't think the government has a right to force you to put a muzzle on your face, period. I don't think that people have ceded so much ground, and it just drives me nuts. I don't know. I've obviously been very vocal on the topic, and it has made a difference. I know I've woken a lot of people up. and at least got them asking questions. But you're right about the personality thing, because I'm not a super agreeable person, and I don't really care about being in the majority. I don't really care if people dislike me. I don't mind rocking the boat, which serves me well in life. But at the same time, I'm very open-minded, always willing to listen, willing to be challenged, willing to be questioned, etc.
And I would add on top of that too, Zuby, though, being humble. And that might surprise some people, but it's true, because if you're a humble person, you're going to be willing to listen to other people's opinions, and you don't necessarily feel that like you always have to be right. But some people who are really arrogant and they always have to be right, their opinion is always gonna matter most, and they're not going to look at other sources or other sources of information, because they already know that they're right. And that's something that we really need to change in society these days as well, is that people are they're actually, even if they know they're wrong, they will still make the statement, because they don't want to go back and say that and admit that they were wrong, which is terrible. And I think that that's happening to a lot of people now. They've said something like, I've thought about this many times before. Like, there's so many doctors online that they've been preaching all these things so much during COVID about lockdowns and stuff, that like it's so hard for them now to like go against what has been said for the last 12 months, in spite of new evidence that shows them that they're wrong. And I'm willing to admit, like, the first month or so, like, I was kind of scared by it. So I didn't know like what was going to happen. And like, I had only was looking at numbers from like the CDC, which is supposed to be obviously trusted organization, and it was saying like the death rate was like 2 to 3%, and that was and it was like about 2 to 3%, and then we're saying also it was like 2 to 3 times more transmittable than like than the common flu. And like, if that had been true, like that would have been pretty scary, and it would have overwhelmed the hospitals, like, for sure. But like, we don't live in that world anymore. We have new data. So like, when new data comes out, you have to be humble enough to change your opinion, and you have to be objective. And that's the thing too, is that like, people who are pro lockdown, and I love what you said earlier, because this ties in really well. Like, people who are pro lockdown, they're only looking at studies that show that lockdowns are effective. And again, like, you don't want to be the other way too. You don't want to be so anti-lockdown that you only look at the studies that show that lockdowns aren't effective.
Do you know what? Like, I'm anti-lockdown regardless of any studies.
Yeah.
The studies don't matter, right? I mean, I'm anti-lockdown from a freedom and a liberty perspective, right? I think it's a human rights issue to me. It's like, people have to be able to make choices. But with that said, also the evidence for lockdowns actually being effective at doing what people say they're supposed to do. I mean, if you look at the USA, you've got data from all 50 states now. You can compare the states that locked down versus the ones that didn't. All 50 of them. All the data is there now. You've got global data. You know, you can compare the UK and Sweden. You can compare you can compare Belarus and Spain, whatever comparison you want to do. You know, and I think it's hilarious that there's three countries people always jump to. They jump to Australia, New Zealand, and South Korea as evidence that lockdowns supposedly work. But again, this is just confirmation bias because they're totally ignoring Sweden and Belarus and Florida and Georgia and places like, you know, within their own country, if they're American, where they didn't do all these lockdowns and mandates. And in fact, the average rate of death in the states that did not lock down is slightly lower than in the ones that did. Do you know the truth about this whole situation? I think there are some really obvious truths that people do not want to just acknowledge and admit. And I think a big one is a virus is going to do what a virus does. Mm-hmm. Right? There's no policy or something that can be done on a large scale, certainly in a country with dozens or hundreds of millions of people, that's going to lead to zero deaths and zero hospitalizations. Like it's just not reality, right? You look at the common flu. Common flu, you know, takes out a couple dozen thousand people in the US every year, I believe. And that's just reality. Like no one wants to admit it because I think our society is very uncomfortable with death in a lot of ways. I think Western society is just very uncomfortable with it. So no one wants to admit, and certainly no politician wants to say, hey, you know what? No matter what we do, some people are going to die. Like that's, you know, it's the truth. It's the truth. But politicians don't want to say that. And then on top of that, I think based on, I mean, if you look at this thing globally, okay, just look at Africa. Okay. I don't think a single African country got hit extremely hard with this thing. Not one, right? And we know that there's much more poverty there. The medical systems, et cetera, even the political systems are not up to the same standard and quality as they are in the Western world. But much younger demographic, different climate. People actually probably have quite different immune systems there, et cetera. I think that the truth is about this whole situation is that the factors which contribute the most to the infection rates and hospitalization rates and absolutely death rates are cannot be affected really by policy. Like they just can't, right? Age of population, climate, population density, etc. Like whatever you do, you can't do anything about that. I think in politics, because the way everything gets politicized, you always have not everything has a political solution. That's the reality, right? Not everything has a clear political solution, but nobody can just admit that and go, okay, you know, people want to do something, right? There's always that thing. We got to do something. It doesn't matter if it's effective. It doesn't matter if it's proven. We just got to do something. Just put this thing on your face. It'll make us feel like we're doing something. Whether or not it works, we don't know, but just do it, you know?
Yeah. And I mean, people need to be more, I mean, they have been a little bit vocal about it, but like they're, like you mentioned, basically just like non-modifiable risk factors. Like these exist. There's nothing we can do about them. Like we know that, you know, being over the age of 75 is going to put you more at risk than say if you're 35, you know, like significantly more. And it gets worse if you go to 85. And we know that, you know, males unfortunately do worse with it than females. But like we can't, you know, change anyone's age. And I guess I can say this on your
Well, Mike, it is 2021.
So, you know, it's something that, you know, we have to look at that like objectively, you know, like if you have an aging population and if a lot of that, you know, generally speaking, you know, there's the male and female ratio is always pretty even anyway. But if you have an aging, you know, male population, then like some of those people are going to die. And like the reality is that like 100% of us that are, you know, listening to this right now are going to die. Like you already have, you know, a diagnosis of death. You just don't know, you know, when it's coming. So, you know, I think that people need to just grasp that and understand that is the reality, that like there's certain things that like we can't change. And I know that, interestingly, schizophrenia is actually a major risk factor for it.
Oh, I didn't know that. Interesting.
Yeah, I saw that from this guy William Wallace. He tweeted out fairly recently. So and a lot of that.
Why would that be? I'm just curious. I don't see any connection there.
Yeah, I have to like look into like the pathophysiology behind it too. But I would say that a lot of people who have schizophrenia, are not doing the things that we're promoting, like the vitamin D,
Okay.
exercise, sleeping 7, 8 hours a night. A lot of people with schizophrenia smoke a lot of cigarettes as well. I'd say that's where a lot of it is. But again, like some of these risk factors are non-modifiable. So, what we should be doing is looking at the modifiable risk factors. And again, the things that we can control. And, again, like, coming back, like the social distancing and the masks. I mean, when you're like 6 years old, like you're taught, like if someone, sneezes on you, like to get out of the way, like you don't want germs on you. Like everyone, knows that. But like, that's just one strategy for not getting sick. Like there's also other strategies for not getting sick. Like I haven't had the common cold in like, I mean, I've never, put it this way, I've never missed a day of work from a common cold in over 7 years since I've been practicing. I've only actually missed half a day of work one time in 7 years, just because I actually had food poisoning and I threw up like crazy, and that was it. And then I was back to work, the next day. And part of the reason why I think that I never miss a day is because I do take care of myself proactively. So all these things that we were talking about, I was doing before. So again, like we really need to understand that there's non-modifiable risk factors. There's nothing we can do about. You need to be honest about that, and people need to understand that, like, if a virus comes out, and there's certain risk factors that we can't modify, some of those people are going to get sick and are going to die. So let's concentrate on the modifiable risk factors that we can change something about, and then go from there. And unfortunately, we're just not seeing that in the mainstream media and the news and from governmental organizations.
Mm-hmm. For real. And let's focus resources on the people we know are vulnerable, not on 100% of the population, right? In any given population, maybe you have, I don't know, somewhere between 10 to 20% of the population might be in the more vulnerable demographics. And again, something that's blown my mind, assuming that this is actually about keeping people healthy and protecting people, one thing that's blown my mind is just the one size fits all approach, right? Treating 5-year-olds the same way as 15-year-olds. Well, I guess 5 and 15 you can actually treat the same, but treating 5-year-olds the same way as you're treating 75-year-olds and 95-year-olds, and acting as if this whole disease is just as bad across all of these demographics, and just punishing absolutely everybody, punishing 100% of the population for the image and with the assumption that you're somehow protecting the 15 to 20%, when in many cases you're not. And just this crazy myopia, as if this is the only virus that exists and this is the only thing that people can die from or be harmed from. The total absence of thought of the impact of these lockdowns. We're talking about health. I mean, in the UK, I don't know in Canada, in the UK, do you know the leading cause of death for the past 10 years of people under 40?
Probably motor vehicle accidents.
Suicide.
Wow.
Biggest killer of people under 40 in the UK for the past 10 years is suicide. So what should we do? Oh, we should stop everyone from seeing their friends and families. We should stop people from going to school and university. We should close down businesses and put people under financial stress so they can't. And we should also cover up everyone's faces. We shouldn't let them go outside. We should force them to stay at home even if they're perfect. Like, yeah, that's going to help, isn't it? This is the thing that blows my mind. It's so frustrating. It's like, it's such a myopic approach to something that's actually really holistic, both in terms of health itself, but also in terms of the repercussions of the policies. Like, the reality is we're dealing with trade-offs, right? Nothing's absolute, right? If you do, lockdowns, people are acting as if lockdowns have no negative effects, right?
Yeah.
Right? They're acting like, okay, we'll just do the lockdown and forget the economy, forget physical health, forget mental health, forget all people getting treatments for cancer and all these other non-COVID related illnesses, which generally more people die from, heart disease, cancers, etc. It's like COVID has become this deity. It's become this deity whereas if you get sick or you die from COVID, that matters more than any other source of illness or death, right? Where, to me, this is like a philosophical question going beyond medicine and health and policies. This is philosophical. I don't remember where we as societies decided, do you know what the most important thing in the entire world is? Do you know the most important thing in Canada, the most important thing in the UK is COVID, right? That's the most important thing. Cases, hospitalizations, deaths from this particular disease, that's the most important thing. Forget about freedom, forget about liberty, forget about general health, forget about the economy, forget about children, forget about debt, forget about everything else. All we need to do is try to get that number down, which to me is insane. Like that's insane. And it blows my mind because I'm here. I mean, I'm a flipping rapper, right? I'm not just a rapper. I'm a smart dude, but I'm watching all these people who we've given this authority to, I guess, who are setting these policies and doing these things. And it's just like, how are y'all so blind to the other factors and the other impacts that are going on here? I mean, I've said for over 6 months, I think that the cure is far worse than the disease. I believe that more people in the long term are going to die as a result of the response rather than the disease itself, let alone the suffering on top of actual deaths. I truly believe that.
Yeah, and there's so much to unwrap there. There's a few points like I
Yeah.
want to make. So, like the schools, for example, so it was said about maybe 2 or 3 weeks ago, Fauci came out and like Fauci's been wrong about basically everything.
I've been more right than Fauci through this whole thing.
But like basically, he said that, he agrees with the CDC saying that schools should have never, been closed. And like that is quite a mea culpa, right?
Yeah.
Like you're talking about, literally like millions, if not billions of children that were supposed to be in school that are not in school now. And like, what is that doing for their development? That's a
Seriously.
scary thing, especially with like kids, between the ages of say like 2 to 6 or 3 to 6, like in that category, like that's when your brain is actually developing. And like people need to understand like what other people look like, like they have to recognize a stranger's face. They have to recognize, what their parents' face looks like. They need to understand, what's safe and what's not safe. And, that's going to, certainly have a lot of, long-term repercussions, I believe. And people always talk about, like, oh, is there any long-term evidence for this study or for this drug and things like that? And people sometimes, like I prescribe TRT at my clinic, testosterone replacement therapy, and like there's not very many super long-term studies on that, but it's something that you can prescribe, right? Whereas like if you look at the vaccines, for example, that's something that has just been done in like 9 to 12 months. And like we should be looking at that and questioning that, like what are the long-term studies of that, and we don't have,
It's impossible to have any yet. It's too
right?
new.
So we really need to be careful about saying that certain things, we can't prescribe something unless there's long-term studies, and then looking at the vaccine and then like, well, look what you're doing now, like there's no studies on this, there's no long-term studies.
Look, I think ultimately the thing for me is, I feel like everyone understood this up until about a year ago. For me, it just comes down to personal risk analysis and responsibility and choices. If you're going to live in a supposedly free society, people have to have a large degree of autonomy and ability to make choices. If someone wants to, I have no problem with someone wearing a mask or socially distancing or not going outside if they're worried about things. I have no problem with someone taking a vaccine or taking any medicine, whatever it is that they think is going to benefit them based on their personal profile, their lifestyle, their health, their risk analysis, the people they're surrounded by, whatever. The thing that I do not like and the thing that I stand against is mandates, right? It's the mandates. It's the forcing this and making this mandatory, making that mandatory. That's the part that freaks me the heck out, right? If someone wants to take, a vaccine, if someone wants to take CBD oil, I'm with you, right? Like that's your choice, right? It doesn't mean I want to take it or I want to do it, right? It's like tattoos. I don't have any tattoos. I don't want any tattoos, but I'm not going to be like, yo, I don't want a tattoo, so you can't have one. Or I'm not going to be there like chasing you around with a tattoo machine, trying to trying to put the ink in your skin. You see what I mean? And it's like, I feel like we generally understood this as a society, regardless of your sort of socio-political views. We generally agreed on this stuff, but suddenly people have been propagandized. They're hysterical. And now I've never seen so many people in my life running around demanding that absolute strangers do certain things to placate their own personal fears. I've never seen that kind of behavior before.
Yeah, it's crazy. I mean, we really need to get away from, telling other people what to do. And like, I agree with you. Like, things shouldn't be mandated. People should be, making their own decisions. I think that's, the big issue is that people are not making their own decisions with COVID. They're just, listening to others. And that's where the danger comes in. And that's why the best ideas are not being heard.
Mm-hmm. Yeah, it's a weird one. So how do we get out of this, Mike?
It's tough. It's a real tough situation. I think that, what we need to do is, we just need to get people to start taking better care of their immune systems, take the vitamin D, and, do all the things that we've been saying this whole podcast, and start to think for yourself. And if you do that, you're not only just going to prevent COVID, but I think, your whole health is going to turn around. So think for yourself, do the things that, you feel are best. Listen to various different sources. Don't just listen to one source, and experiment with different things, and then, go from there. Don't just listen to one source. I think it's the biggest thing.
100%, man. And Mike, do you have anything that's coming up this year or coming up soon, or that you've got out that you want listeners to know about?
So I actually just released my own podcast. It's called the Hart to Hart podcast. My last name's Hart, so that's where I got the name from. So, hopefully some of your listeners, when they're not listening to your podcast, will just, click over to mine and check that out.
Awesome. Mike, and where can people follow you online?
So they can follow me online. I'm at Dr. Mike Hart on everything. So it's DrMikeHart. I'm on Twitter. I'm on Instagram. I'm on Facebook. I'm on LinkedIn. My website is MikeHartMD.com. And you can find me basically all over the internet there.
Awesome, man. So good to speak to you, Mike, man. It's been a pleasure.
Yeah, man. It's been great. Thank you so much, Zuby.